All right, so we're going to be doing some bed mobility today. Before we begin, we're going to check to see if the brakes on the bed are on. And it appears that they are on. And next thing we're going to do is expose the lower extremities. All right, so we see that the patient has grippy socks on, so we're good to go. Next thing, we can look around the bed for any kind of hazards, and it looks like it's clear. It also looks like the patient is a little bit too close to the foot of the bed, so we're going to do our best to scoot towards the head of the bed. So to do this, I'm going to ask her to slide her heels up towards her bottom. Good. And can you use your elbows to push into the bed? Good. And it appears that the patient has right upper extremity weakness. Before we start moving, I'm going to remove the pillow from behind her head to allow her to scoot. All right, so then I'm going to ask her, using your heels or your feet and your left arm, I want you to lift your butt up, lift your head up, and use those your legs and your arm to help scoot you towards the head of the bed. So whenever you're ready. Good. All right, and then the same thing, we're going to scoot towards the foot of the bed. See how well you can do that. So using your feet and your left arm, can you scoot down towards the foot of the bed, lifting your bottom and your head? Good. And with both moving to the head of the bed and to the foot of the bed, it appears that the patient does require some minimal assistance. Next thing we'll do is move from side to side to see how well she can move from side to side of the bed. So using the same technique, I'm going to ask her to use her legs and her left arm to scoot towards me. So whenever you're ready, you can lift up your bottom and lift up your head and scoot towards me. Good. All right, so that motion also requires minimal assistance. So next thing I'm going to ask her to do is see if she can rotate towards me. So to do this, we're going to straighten out the left leg, leaving the right leg bent. So I'm going to ask you to use your right leg to reach over to help you rotate towards me. And then I'll be here to help you rotate your upper extremity just as much as you need me, okay?
Okay.
So whenever you're ready, you can rotate. Good. All right. Then lay you back flat. Good. And with rotating to the left side of the bed, it appears that the patient does require some minimal assistance. We're going to raise the rail and then test the other side. All right, so using the same technique, I'm going to ask you to bring your heels to your bottom. Good. And then again, we're going to use our elbow and feet to help wiggle you towards my direction of the bed or the right side of the bed. So whenever you're ready, you can lift your elbow up or drive your elbow into the bed and do your best to wiggle your way towards me. Good. All right. So with moving towards the right side of the bed, the patient did require minimal assistance. All right, so now we're going to rotate towards the right side of the bed. So whenever you're ready, you can use your left arm to reach towards the side of the bed to help pull you or rotate you towards me. And then we can lay this leg down. And again, you can use this left leg to drive or rotate your lower extremity towards me as well. So whenever you're ready, I'll be here to spot you to make sure you can rotate. Good. All right. So with rotating to the right side of the bed, the patient was independent, so she could rotate by herself. All right, so we roll back flat. Good. So since she has difficulty, or more difficulty rotating to the left side of the bed, we're going to sit up on that side. All right, so again, we're going to first scoot towards me. So bring your heels to your bottom. All right, and bring both your elbows up into the bed as best you can. And then, again, do your best to wiggle your way towards me. Good. All right, and again, we're going to place this leg down and use your right leg to drive your lower extremity towards me or your lower body towards me. And then I'll assist you as much as you need to rotate your upper extremity towards me, okay? All right, whenever you're ready. Good. All right, so with your lower body, since you have control of both legs, I'm gonna ask you to bring your legs up to the edge of the bed, and then I'll help you as much as you need, but use this left arm to get up into a sitting position, and I'll just be here to spot you, okay?
Okay.
All right, so whenever you're ready. Good. All right, from here I would lower the bed to where her feet are on the floor to check for her static sitting balance, and it appears that it is good. Also, going from supine to sitting, the patient did require standby assistance just for her safety based off her stability.